Imagine, just for a moment, that you are walking into the absolute pinnacle of modern civilization's medical infrastructure. The year is 1846. You are in Vienna, the shining cultural capital of Europe. You are entering the Allgemeines Krankenhaus, the General Hospital. This isn't some back alley clinic. This is the fortress of academic medicine, staffed by the most prestigious professors and the brightest medical students in the empire. Now, imagine I told you that by stepping into the first clinic of this hospital to give birth, you were accepting a mortality rate that essentially amounted to playing Russian roulette. We are talking about a 10, sometimes 18% chance that you will not leave that building alive. And here is the truly terrifying statistic, the data point that should have shattered the world back then. If you simply walked out the front door and gave birth in the gutter, on the street, your chances of survival increased tenfold. Welcome to the paradox of Ignaz Semmelweis. Today, we are not just talking about hand washing. That's too simple. We are dissecting the birth of evidence-based medicine, the concept of iatrogenesis, doctor-caused death, and the psychological phenomenon known as the Semmelweis reflex, which explains why the smartest people in the room are often the last to see the truth. Welcome to Dr. Evolution's Toolbox, where I share tools we are using to build a better world with biology. As a disclaimer, nothing I say should be considered medical advice. This information is for educational and entertainment purposes only, and these are my views alone and do not necessarily reflect the views of my employer. To really understand the detective story Semmelweis found himself in, we have to strip away everything we know about biology. You have to unknow the germ theory. In the 1840s, Louis Pasteur and Robert Koch hadn't yet revolutionized the world. Bacteria were invisible, conceptually non-existent to the average clinician. The medical paradigm of the time was dominated by two massive, incorrect theories. First, you had humoral pathology, this old Galenic idea that disease was just an imbalance of fluids, too much bile, too much blood. But the bigger player was miasmatic theory, the belief that bad air or atmospheric clouds of decay floated through cities and caused disease. They believed that epidemics were caused by cosmic telluric influences, literally planetary movements or earthquakes shifting the atmosphere. So here is Semmelweis, a young, obsessive Hungarian physician working in Vienna. He looks at the data. The hospital has 2 obstetrical wards. The first clinic is staffed by the elite, medical students and professors. The second clinic is staffed by midwives. The first clinic is a slaughterhouse. Puerperal fever, which we now know as sepsis, is raging. Women are begging on their knees not to be admitted to the first clinic. They know the reputation. They prefer the midwives' clinic next door, where the mortality rate is a calm, consistent 2%. Now, a rigid academic mind of the 1840s would look at this and say, well, the miasma must be worse in the first clinic. But Semmelweis possesses the mind of a modern epidemiologist. He looks at the variables. Both clinics are in the same hospital. They share the same air, they share the same water, they share the same diet. If the miasma is atmospheric, it shouldn't discriminate by room number. He starts a process of elimination that is breathtaking in its rigor. Is it overcrowding? No, the second clinic is actually more crowded. Is it religion? The priest walking through with a bell? He changes the priest's route. No change in the death rate. Is it the birthing position? He forces the women in the first clinic to give birth on their sides like the midwives do. No change. The breakthrough, the catalyst that changes medical history, comes from a tragedy. In 1847, Semmelweis's good friend and colleague, Jakob Kolletschka, is performing an autopsy. A student's scalpel slips and nicks Kolletschka's finger. It's a minor wound, but within days, Kolletschka is dead. Semmelweis reviews the autopsy report of his friend. He sees inflammation of the membranes, pleuritis, pericarditis, peritonitis. He realizes with a jolt of horror that his friend's pathology is identical, visually and structurally identical, to the women dying of childbed fever. But Kolletschka didn't have a uterus. He wasn't postpartum. He had a wound that was exposed to a cadaver. This is the aha moment. Semmelweis connects the workflow. In the first clinic, the medical students start their day in the morgue. They are dissecting bodies, learning anatomy, their hands deep in decaying organic matter. Then, without washing, or perhaps just a cursory rinse with soap, which does nothing for the smell, they walk directly upstairs to the maternity ward to perform vaginal examinations on laboring women. The midwives in the second clinic, they don't perform autopsies. They don't touch the dead. Semmelweis formulates a hypothesis that is brilliantly simple, yet biologically blind. He doesn't know what bacteria are, so he calls the vector cadaverous particles. He hypothesizes that these microscopic pieces of death are sticking to the hands of the doctors and being inserted directly into the vascular system of these women via the raw wounds of childbirth. He realizes that the smell is the key. Soap and water didn't remove the smell of the morgue. He reasoned that if the smell is there, the particles are there. He needed a chemical oxidizer. He needed something that would destroy the organic matter completely. He chose calcarea chlorata, a chlorinated lime solution, essentially bleach. In May 1847, he drops the hammer. He installs a basin of chlorine solution at the entrance of the clinic. He institutes a mandatory policy. Every single student and physician must scrub their hands until the smell of the morgue is entirely gone before they touch a patient. The results are not just good, they are statistically impossible to ignore. In the months prior, mortality was floating around 12%. In June, after the chlorine wash begins, it drops to 2.38%. By August, 1.9%. In 1848, the first clinic, the place that was once a death sentence, goes 2 entire months with 0 deaths. The disparity between the doctors and the midwives vanishes. The curve is flattened to the floor. Now, if this were a movie, the credits would roll, and Semmelweis would be hoisted on shoulders as a hero. But this is the history of science, and it is rarely that kind. This brings us to the deep, resonant lesson that applies to every biotech startup and research lab today. The data was perfect, but the reception was hostile. This is what we now call the Semmelweis reflex, the automatic rejection of new information because it contradicts established norms. Semmelweis was telling the most powerful aristocratic men in Vienna that they were the dirty ones. He was challenging their social status. In their minds, a gentleman's hands were socially clean, therefore they couldn't be medically dirty. He was suggesting that the doctors were the vector of death. That's a hard pill to swallow for a narcissist with a tenure track. Furthermore, he had a theoretical vacuum. He had the what, chlorine stops death, but not the why, bacteria cause sepsis, because he couldn't show them the microbe under a microscope. Because the microscope technology and staining techniques weren't there yet, they dismissed his data as a fluke. They went back to talking about cosmic telluric influences. It wasn't until decades later that Pasteur identified the streptococcus in the blood and Lister operationalized antisepsis in surgery that Semmelweis was vindicated. But by then, Semmelweis had died in an asylum, beaten to death by guards, ironically succumbing to sepsis from a gangrenous wound, the very disease he spent his life fighting. So what are the implications for us, right now in the 21st century? Semmelweis is the patron saint of the black swan event in data. He teaches us that you don't need to understand the mechanism to respect the outcome. If an intervention works, if the data is robust, reproducible, and statistically significant, you have a moral imperative to act on it, even if it contradicts the current dogma. We see this today in the search for biomarkers, in AI-driven drug discovery, and in genomic medicine. We are often finding correlations, patterns in the noise, before we fully understand the biological pathway. Semmelweis teaches us to trust the pattern. His legacy is the cornerstone of modern infection control. Every time a surgeon scrubs in, every time you see a wash your hands sign in a hospital, that is an echo of Ignaz Semmelweis. He proved that the simplest intervention is often the most powerful. He proved that iatrogenesis, harm caused by the healer, is real and must be guarded against with relentless vigilance. But most importantly, he serves as a warning against intellectual arrogance. The establishment in Vienna was so sure of their miasmatic theory that they let women die rather than wash their hands. We must ask ourselves, what are the miasmas of our time? What are the things we are so sure of today that will look barbaric and foolish in 150 years? Science is not a static list of facts. It is a constantly evolving method of error correction. Semmelweis provided the correction. The world just wasn't ready to accept the error. So the next time you see a piece of data that doesn't fit your worldview or a result that challenges the status quo, don't look away. Don't revert to the dogma. Scrub up, look closer, and follow the evidence. It might just save a life.